Well, in this week's Cardiology News, we have two papers from JACC Heart Failure this month and one from JACC. And we'll begin with one that looked at the use of biomarkers in the outpatient assessment of heart failure. This was a 10-year study that looked at baseline measurements and measurements of NT-proBNP and troponin done 1 to 3 years after the initial assessment. And they found that there were some patients who had increases in either NT-proBNP or troponin, being 15% for troponin, 13% for NT-proBNP, and 6% having increases in both. And those who did have increases in both had an incidence of heart failure developing in 50% as compared with just 12% of those in whom neither of the biomarkers increased. Also, there was an echo assessment and there was a much higher incidence of LV dysfunction in those who had increases in the biomarkers. And so these suggest that in addition to use acutely, that these may be useful in the longer-term prediction of heart failure over a 10-year period. Next, we have another paper from JACC Heart Failure, the PRAISE-2 trial. And this was a follow-up trial of amlodipine in patients with non-ischemic cardiomyopathy. There had been a suggestion in the PRAISE-1 trial of a potential benefit in this subgroup of patients. And so colleagues randomized 1,650 patients to amlodipine with a target dose of up to 10 milligrams a day or placebo on top of all the standard heart failure medications. And they found no increase or decrease in mortality over the next approximately 3 years. And so no adverse effect of this added medication. They did find more common peripheral edema and hospitalization for pulmonary edema, but less uncontrolled hypertension. And so on balance, they found that this is an option that wouldn't adversely affect prognosis in heart failure, but also one that did not confirm an earlier subgroup analysis, and so reaffirming overall caution of pulling out subgroups from some trials for potential benefit. And this week's top pick is a study that looked at niacin's effect on HDL function. This is a small study in just 39 patients, but one that does an assay for HDL function looking at the efflux of cholesterol from macrophages from a randomized study of niacin versus placebo in patients with carotid atherosclerosis already on a statin. And what they found was the expected increase in HDL levels of increase in 29%, but no change in the HDL ability to efflux cholesterol. Also, no change in the HDL inflammatory index. So this suggests that there may be somewhat of a disconnect between HDL levels and HDL's function, and so this may help explain some of the negative findings we've seen in HDL raising trials of late. Obviously, further information needs to be done, but this is an important insight into HDL and how it is more difficult than simply raising the level in terms of getting benefit clinically. So for Cardiosource News, I'm Chris Cannon.